I'm Lisa Carberg. Welcome to another edition of Medical Monday. It is February, and February is Heart Health Month for both men and women, and we're here to educate. You are going to hear from a woman whose mother had very vague symptoms. You will hear from a cardiologist and from someone with the Heart Association. So let me first bring in Elisa Pacherno. She is a very dear friend of mine. We go way back, and I've always been medical reporting, and I covered after. Tell us about your mom, first off, as we look at a few pictures of your mom with your children when they were a little younger.
Oh my Lord. My mom was just a ball of energy. That's what she was. She was always the life of the party. She was always on the go. She was involved in so many different things. She was a teacher. Her passion was, passing it on to young students. But even when she retired, she was immersed in everything her church, nonprofit groups. She still maintains some contact with her academic associations and, volunteered for, awards programs.
So she
But
was a
she was just,
spitfire.
she was a spitfire and always hopping around. And people tell me that I get my energy from her. So
You are definitely one. All right, so tell me about your mom's journey. Tell us about what happened to your mom.
So basically, it was a situation where, quite simply, she was here for Christmas celebrating, and then 1 week later on New Year's Day, she was deceased. And what happened during that time was right after Christmas, which she actually spent with me that last year she was alive, and my children. She went a couple days later into Rhode Island to visit my brother and her other granddaughter. And apparently, along the way, in the car ride from Connecticut to Rhode Island, she started feeling very tired, very kind of listless. And like she kind of, was telling my father that she thought it might be the touch of the flu. Didn't really think anything of it. Arrives in Rhode Island and has to immediately take a nap and lie down, which is not like her at all. So she has a lot of energy. So that was the first indicator that something was going on. In talking to my father, he said, "Yeah, she kind of was just like kind of lethargic, lethargic, no energy, just kind of tired." So she went and she took a nap when she got arrived in Rhode Island. This is again a few days after Christmas. And then the other symptom that she had was she didn't have any appetite. And apparently she had been complaining a little bit about, gastrointestinal distress, meaning she had a little bit of diarrhea, and heartburn. She was experiencing, diarrhea like symptoms, heartburn, and again, the listlessness, no energy, and no appetite.
And I would never think of a
Go,
heart attack for that. This is the interesting
no,
part about your mother's
no.
story that we want to help people with.
Yes, yes. Symptoms typically, you don't really think about that when, because we all experience that at one time or another. And so it was, I think, the combination of everything, right? And, whether my mom knew something was really off or not, she didn't communicate that, with my family, with my brother and his family and my father. So overnight, apparently she couldn't sleep very well, right? Even though she was extremely tired, she couldn't sleep really well. She was up the next morning, which I believe was like a Saturday, and my brother and his wife, who happened to be a pediatrician, was kind of like monitoring her a little bit and just asking what did she have any other symptoms? She was saying no, it still feels like heartburn, really really tired, and no appetite. So they then decided to drive from Rhode Island back to Connecticut, where her home base of doctors were. And I guess as they were coming back to into Connecticut, her symptoms started to intensify a little more, all those like kind of four symptoms. And so they brought her into the hospital. And when she arrived back in New Britain, in her hometown, and they determined that she was indeed having a heart attack, and her troponin levels were like all over the place. They couldn't get them, normalized.
So then what? How did they treat her? What happened next?
They treated her in the hospital with they had the compression monitors going. So they were like, making sure that, her blood flow was happening, but they were giving her a bunch of medicine. And that's when I went into the hospital and saw her. And quite honestly, she looked great. I mean, she was like, "Hi, sweetheart." She still had her energy. Her
Wow.
energy was back. I know it was definitely something to be seen. I didn't believe she was having a heart
Of
attack,
course not.
because It was not
There's
the
your
typical
mom.
symptoms.
Yes.
She's my mom, and it didn't seem like that at all. But apparently they were, treating her, and they couldn't get the troponin levels under control, so they decided to later on that day transfer her to a different hospital where they said she could get more of the care that she needed, for her cardiac event. That did happen. They did transfer her, and I had at that point I had not seen her again. That last time I saw her was in that first hospital, because it happened to be New Year's Eve, and she was transferred to the other hospital on New Year's Eve day. And at that point, again, she hadn't eaten in like what now, like 4 days, because she didn't have an appetite. But when I called her later on that night, because a tradition of ours was to always, call each other on New Year's Eve, usually at midnight, when the ball dropped. But I called her earlier in the evening, probably around 7. And again, the energy was just like there, and she had just eaten mashed potatoes. So she felt great that she, had finally eaten in, over like a 4 day period of time of not having an appetite and eating. And she sounded wonderful. And the next day she was going to have a consult and hopefully have some robotic surgery, that they were going to do something with the heart. I don't know all the details at that point because she really wasn't sharing them. But that was going to be the plan. So I hung up the phone, and actually at midnight, I ended up calling her. I'm like, well, if she's finally getting some rest and some sleep, and I don't really want to bother her, but I felt compelled to pick up the phone and call her in her hotel, in her hospital room, and I did. And somebody picked up the phone, and then it went dead. And I'm like, mom, I just want to wish you happy New Year. And there was no answer on the other side of the phone, other line. And then the line just went dead. And I'm like, okay, well, I'm just going to go to sleep, and I'll call her first thing in the morning, or when I'm up with my kids. And
We have
that
about
didn't
1 minute
happen.
left in the segment. So,
Yeah, that didn't happen. So basically, we got the phone call at 3 a.m. on New Year's Day, that from the hospital, that she was in heart failure, and they were just resuscitating her to until we could come and say goodbye.
Elisa, that is so unbelievable. I remember right afterwards, I went to your parents' house and you told me this story. And it is just such a perfect example of how heart attack symptoms present themselves differently in everybody. I've heard some of that, some of the indigestion, not themselves, but couldn't sleep. And I thank you for sharing your story. And I hope someone takes away something that could save a life from this. And I don't want women to feel like hypochondriacs to go check things
Right,
out. But we know when our
right.
bodies aren't right. And your
Aren't the
mom was
same.
probably very stoic about it. I mean, we don't really know. But I thank you, and I send the best to your family. I know your kids are grown, and your father is in independent living, and he's just lovely. And thank you so much for sharing this. I really appreciate it, my
You're
friend.
welcome. Happy to
Oh,
help, Lisa.
thank
Thank
you,
you for having
Elisa.
me.
Welcome back to Medical Mondays. I'm Lisa Carberg. We are now about to talk with Dr. Meghana Rao Brito. She is a director of cardiovascular health with Yale New Haven and Lawrence and Memorial Hospital. Doctor, welcome.
Thank you for having me.
Thank you for being here. Let's talk about the importance of Go Red and why we celebrate heart health every February.
Absolutely. Thank you for being a part of the Go Red for Women event last week. It was, I would say, a huge success, in no small part thanks to you. So, why do we need a whole month to talk about women's heart health? You might have heard heart disease is the number one killer of both men and women in our country and worldwide, but there is a prevalence of about 60 million women in our country with cardiovascular disease, and about 450,000 women die every year of heart disease. That's like one woman every 3 minutes. It's too much, or it's too many, I should say.
And
And
so,
so,
oh, keep going,
sorry, go ahead.
please. Go
No,
ahead.
no.
What do you like to get out? So it's very serious, heart disease.
Yeah, yeah,
What should women be aware of? What should they
of
ask their
course.
doctors? What should they be on top of?
Yeah. Part of the problem with cardiovascular disease in women is that our voices are often not heard as loudly and clearly as they should be. So women are more likely to be told that their symptoms are non-cardiac. Women are more likely to present with what we call atypical symptoms. So of course, the number one symptom of presenting with a heart attack is going to be chest pain, both for men and women. but women are more likely to have associated symptoms like profound fatigue, shortness of breath, indigestion, pain in their back. And we see this all the time, women coming in and saying, well, I thought it was reflux, or I thought it was anxiety and stress. And so some of that is on us, but a lot of times when women do present to the hospital, they're told, oh, you're just stressed, you're just anxious. So awareness and knowledge of what the possible symptoms are and the importance of presenting to a hospital or presenting to see your doctor if you develop symptoms that are out of the ordinary for you. That I would say is the number one message.
And what about women advocating for themselves? Like you said, they could say, oh, it's nothing, just go home. And we know when our bodies aren't right, when something's wrong.
I mean, I say the same thing. If you've heard me talk before, I say the same thing over and over again. You know yourself more than anyone else knows you, right? You should be your number one advocate. But again, we, especially women of our age group, are so busy taking care of our children and our spouses and our parents and our jobs that we tend to put ourselves last in the priority list. And so, two things. Number one, prioritize yourself, because if you aren't healthy, you're not going to be able to take care of everyone around you. And number two, if you feel like something is wrong, you know that you're not feeling like yourself and you know something is wrong, and your providers or the people around you are telling you it's no big deal, you're really stressed, you've got a lot going on, it's well within your right to seek a second opinion, right? Find a provider that you connect with, find a
Right.
doctor you connect with.
I'm big on second opinions. I do in my medical reporting. Someone just had a glioblastoma brain tumor, and they got a second opinion, and they're doing pretty well. All right, doctor, let's talk about know your numbers. What does that mean?
Yeah, yeah. Know your numbers really is knowledge is power, right? What are your numbers? Well, the risk factors, the most common risk factors for cardiovascular disease are going to be high blood pressure. So the number there is going to be having a systolic, or the top number, less than 120, and the bottom number, your diastolic blood pressure, less than 80. So that's your perfect blood pressure is going to be less than 120 over 80. When we start creeping up between 120 and 130 over 80 and 90. And anything over that is considered high blood pressure. So you want to know what your blood pressure is. You'd be surprised how many people have no idea, just have no idea. They're walking around with high blood pressure for years and years and years without anyone ever saying, hey, maybe you should treat that.
And it's easily treatable, right? There are
So,
options,
so
lots of
easily
pills.
treatable. Yes. Well, first and foremost is
Right,
lifestyle
right,
changes. Right?
totally.
So low sodium diet and lots of activity. We live in a world where we're sitting in front of computers all day long. Get up and move around. Even if you don't have the time to build in an hour at the gym, get up once an hour at your desk and bust out some squats or some push-ups, or, whatever you can do where you're sitting is something. It's better than nothing. So activity, activity, activity. Isometric exercise has been shown to be the largest driver of decreased blood pressure, and
Wow.
then minimizing your salt intake. So the first things are lifestyle, and if you still can't get to the goal, there are lots and lots of med options. And no one likes taking meds. I
Right.
hear this all the time. I don't like meds, but we are so lucky to have such a variety of meds. We can find something that works for you
And
that
doctor,
you'll
you
tolerate.
talk about being active. What if someone is watching saying, I don't know where to start to help my
Yeah.
heart or to be, talk about even minimal amounts of exercise. I see these studies on walking or just getting started seems to be effective.
Of course. So more is better. So you have to assess where you are. So if you're someone who walks 30 minutes 3 days a week, you're doing great. Can you do more? Can you get your heart rate up? What else can you do? If you're someone that is very sedentary and you're, going from work to home and you're making dinner and you're putting your kids to bed and then you're catching up on the computer and then you're going to bed, starting anywhere is going to be helpful. So I tell patients, figure out what you're capable of first. Can you go for a 5-10 minute walk? Can you do one push-up? Can you do one push-up? Can you do 3 squats? Figure out what your body is capable of and then build on that.
As a heart doctor, what is the biggest issue you see with women and their hearts? What kinds of conditions?
Of course. So when we talk about heart disease, we're not talking about one thing. We're talking about a variety of things, including coronary artery disease. So that's blockages in the pipes that provide blood flow to your heart muscle. Then in women, it's more often to have something that we call non-obstructive coronary disease, meaning disease in the teeny tiny blood vessels that surround the major blood vessels that also provide most of the blood flow to your heart. We talk about heart failure, which is, the walls of your heart becoming weak. There's valves or doors or windows to your heart that can become leaky or tight. Heart disease presents in all different ways. There's, electrical abnormalities like atrial fibrillation and other arrhythmias. A lot of these will present differently, but knowing that something feels unusual is going to be the key to saying something's wrong. And now I have to go down this path to find out what it is. And there's lots of imaging possibilities. We have ultrasounds of the heart, we have stress tests, we have CT scans of the heart. There are lots of different modalities to diagnose heart disease.
Dr. Meghana Rao-Brito, thank you so much for your insight and your expertise. And hopefully we've inspired some women to listen to their bodies and maybe go out and take a walk and get active and try to control our numbers naturally. Thank you so much for your time, and keep up the great work.
Thank you for having me.
Thank you.
Okay.
Welcome back. I'm Lisa Carberg. In this Medical Monday, we're talking about Heart Month and Go Red. We're talking men's health, women's health. And joining us now is Adria Giordano. She is the Connecticut Executive Director of the American Heart Association. Welcome, and thanks for joining us.
Well, Lisa, thank you so much for having me.
So you run your operation. You guys are so amazing with all of your fundraising and, getting the public to know heart disease is the number one killer of men and women. So let's talk about why Heart Month is so important in February.
Yeah, absolutely. And I'm so grateful that you invited me on to your show. We talk about heart disease being the leading cause, as you mentioned, of death for both men and women. And in February, it really helps people to bring awareness to it because most women do not know this. They do not know that the number one killer for women is cardiovascular disease. So, our message during Heart Month is really that anyone can save a life. Know your family history. Women have to be advocating for themselves. And women are also less likely than men to receive bystander CPR. So it's really around bringing awareness to heart disease being the number one killer of women.
And we talked with earlier in the podcast with a woman I know who lost her mother who had very vague symptoms, not the elephant on the chest. She indigestion, nausea, couldn't sleep, wasn't hungry. And I feel like that's the biggest thing that women don't realize is that symptoms aren't always the pain in the arm. Tell us a little bit about that.
Yeah, absolutely. They can be different for women than for men. And I think this is the perfect time for women to pause, check in with their health. If something doesn't feel right, say something because it's never too late. Often we hear that women are putting themselves last. We are the caretakers. We take care of everyone but ourselves. And so we really use this month to amplify the message of women need to understand their own body. And if you're feeling something and it's not feeling right, you need to say something. And so, as you mentioned, women's symptoms can sometimes differ than men. And in many times, women, they dismiss these signs. They think, I'm just tired, I'm just exhausted, I don't get enough sleep. And so this is the time that you have to take a pause, take a moment, and really make sure that you are talking with your doctor, not dismissing any signs, and really just advocating for yourself.
All right, let's, in a moment, we'll talk about defibrillators, hands only CPR, which are all such a great message to save lives. Let's talk a little bit. We had a Go Red event, and you have one coming up to talk about. Go Red New
Yes.
Haven 10-year anniversary, and we have some pictures from the evening. I was honored to once again MC. I'm taking a selfie there, and everybody's bidding. Tell us about the event and how much money you raised. There's the awesome co-chairs. And
Yeah,
go ahead.
absolutely. Thank you so much. And thank you again, Lisa, for coming and for emceeing every year. You do such a fabulous job. Go Red for Women is the American Heart Association's signature event that really harnesses the energy, the passion, and the power that women have to band together and collectively wipe out this disease and change these terrible statistics. In every community across the country, we have Go Red for Women events. We just had our New Haven one last week, as you mentioned, you were there. And then we have one coming up in March in Greater Hartford. And dollars raised are used for life saving educational programs and research. So the funding that we raise really benefits women's heart health.
And the record set that night was so amazing.
Record set,
What
yes.
a generous crowd
$250,000.
in one
Absolutely. And
evening.
this is, yeah, it was. And we raise funds throughout the year. So we like to say it's not just a one night event, it's a year round movement. I mean, they're from our dedicated sponsors to our amazing co chairs, Dr. Ray Brito and Nicole DeMeo. They lead a group of executive women who really cultivate relationships throughout the year. Our donors, our volunteers, our generous sponsors, everyone comes together. So, the night of is truly a celebration of all the hard work that goes in throughout the year.
Let's talk about some programs that you guys are involved in.
Yeah.
Hands only CPR. Tell me about your outreach in the community.
Absolutely. And thank you so much for bringing that to the attention. One of the things, many things I love about the Heart Association is that when we work with companies, corporations, or individuals around fundraising initiatives, we look at what are the needs in communities. Are there needs in schools? Are there needs in other nonprofits? Is it nutrition security? Is it CPR funding for schools? And we work with those individuals and companies to develop a sponsorship or individual giving that will fit the need for that community. So, as you mentioned, CPR is always a need in different communities. So, some of the money that we raise actually purchases CPR training kits that we can bring to other nonprofits, that we can bring to community centers. We've brought them to many different towns and communities and schools throughout Connecticut to educate and train everybody on what our Nation of Lifesavers initiative, that hands only CPR.
And how are people receptive to it? Are younger people receptive, older people? Tell me about the response to people wanting to be trained and save
Yes,
lives, possibly.
absolutely. Absolutely. And we're so grateful. Hartford Healthcare actually funded in Connecticut, and it's the first in New England also, the first only hands only CPR kiosk that's been traveling across the state as well. So people have often heard of CPR certification with the breathing and everything, but not everybody has the resources or the time to become certified in CPR. So hands only CPR is exactly what it sounds like. It's the pushing on the chest without the breathing. And if done correctly and quick enough, it can lead to 2 to 3 times more saving a life. Every minute that goes by that someone waits for EMS or ambulance or fire or police to arrive, every minute that goes by, 10% less chance of survival. So our hands only CPR initiative, anybody can learn it. We teach it in schools, we teach it in communities, we invite companies to come and invite us in. You can go onto our website and learn it. Anybody can learn it. It's just pressing hard and fast in the center of the chest, 100 to 120 beats per minute. The Nation of Lifesavers initiative is the message is that you can be a lifesaver. You don't need to be a medical professional. You don't need to be an EMS person. You can save a life. And so that message is something that is at the heart of all that we do at the American Heart Association, because we know that we need to change these statistics.
All right, we have just under a minute left. Tell us where people can find you, your website, and social media. You guys have a really
Yeah,
good social media game.
absolutely. It's super easy. Facebook and Instagram and X is at HeartCon, CONN. Our website is heart.org/Connecticut. They can also follow me at Adria HeartCon on LinkedIn. On LinkedIn, I'm always posting all of the events that we're doing, and it's just my name, Adria Giordano.
Well, Adria Giordano, the Connecticut Executive Director of the American Heart Association, keep up the good work and thank you for joining us and getting that message out.
Thank you so much,
Thank you.
Lisa.